this is a summary of my life now. Let's see here. So I just thought I'll give you a few updates where we are in terms of the world epidemiologically. As people may know, Europe, you're seeing it's red now. It's pretty much exploding, particularly in Italy, France, Spain, the UK. They're talking about more increased restrictions, shutdowning, lockdowns, fining people like €1,000 in Italy if you don't wear a mask. Lots of austere measures. People think it's really because of winter plus pandemic fatigue that's really set in shop in a big way in Europe. In the rest of the world, the United States is starting to turn red in terms of numbers of cases, particularly in the East Coast, in the middle of the country, the Dakotas that were thought to be remnant of Sturgis. Wisconsin is kind of exploding right now, but notice that California is pretty much still doing really, really well, but we're afraid that this wave will just sweep over, particularly with Thanksgiving and the holidays and as people travel. The CDC has gotten into a lot of trouble because nobody trusts them anymore, because there have been so many reports of aligning with politics and having politics shape what messages they give out. Of course, probably one of the biggest sort of everyone shuddered when the CDC came out with a recommendation that close contacts of people who are positive should not be tested, which of course, in this crowd, everybody knows there's no way that you shouldn't test a close contact of a known positive COVID case. We are moving towards testing rather than away from testing. Of course, they sort of reversed that decision and people, but the damage had already been done. So I think a lot of the CDC in the future will be trying to regain that reputation. In terms of treatment updates, I would say the biggest overall update is yes, a couple of days ago, or actually a few days ago on Friday, the WHO study came out showing that the antiviral remdesivir didn't have any mortality benefit, but it wasn't as precise a study as the NIH studies, which also didn't show any mortality benefit with using that antiviral, but it was, decreased days of time of illness by you shave off about 4 or 5 days if you got remdesivir early on. Other things on the blocks are these steroids, of course, being used. So again, to review for folks, there's 2 big phases for the virus treatment, the COVID treatment: the viral phase, which is early on, and the inflammation phase, which is later on. With the virus phase, you can either give convalescent plasma or antibodies or antivirals. In the later phase, steroids is really the game in town. So people have been also looking at other anti-inflammatories. So this is one called baricitinib that's given in combination with remdesivir in the latest study. Probably shaved off, I would say, a week of recovery time in the sickest patients, but not very different from dexamethasone. So it'll be interesting to see. This costs about $5 and this costs about $3,000. So it'll be interesting to see how these kinds of designer anti-inflammatory drugs fit into treatment. Probably one of the most exciting treatment opportunities I see coming is something like interferon beta. So you see this woman here, she's inhaling it. In the UK, they study this drug, which is kind of both antiviral and anti-inflammation, as an inhaled version, kind of like a nebulizer, like albuterol nebs, and found that it prevented time, progression of disease. So they're studying this as an subcutaneous form now with remdesivir in the NIH study. So it'll be interesting to see what happens. In terms of prevention updates, lots of vaccine news continue to dominate. Pfizer's was on hold recently because they had a safety issue, the details of which are not clear yet, but it's on pause. The AstraZeneca one, which was a front runner, is still on hold in the US, but ongoing in the rest of the world. The FDA just wanted to see some more info about their safety issues and the reason why that one patient in the treatment group got transverse myelitis. In terms of other vaccine news, the Russians, of course, it's like the arms race, the Russians, the Chinese, and the Americans / Europeans, and lots of unorthodox things like approving the vaccine before phase 3 studies in Russia, and similarly in China, they've been using the vaccine on people even before the phase 3 studies are done. So I think a lot of weird stuff going on, but essentially, whoever has that first effective vaccine is going to be the rule of the universe. So that's why everybody's trying to race each other. But hopefully, with the 9 CEOs saying they're not going to release their vaccine until there's adequate safety and efficacy data, at least it's somewhat reassuring. But again, it's a counter argument to Trump's need to have a vaccine before November 3rd, which isn't going to happen. Even the front runner, which is Pfizer, is probably not going to be ready until the end of November at the minimum. I think it's probably going to be spring. And the vaccine was on pause was J&J, not Pfizer, as mentioned. In new prevention news as well, there have really been really interesting, crazy masks that people have been trying to design. Like this one looks like the Jetsons, and there are lots of really weird things, but nothing really beats the regular face mask that we've all been wearing. California, we're kind of simmering down, but everybody knows about the 4 tiers of different restrictions. We still have some disease in the Central Valley, although that's kind of simmering down now, and Imperial County. But California is doing a lot better than the rest of the world. A lot of attention now to when to reopen schools, the indoor dining now in San Francisco and much of the Bay Area. Lots of news about testing. Airlines are testing now, like you can go to Hawaii and not have to quarantine if you get, Oakland is giving free tests. Hawaiian Airlines, I think, is giving free tests. United, you have to pay Hawaiian is actually giving cheaper tests. United, you can buy a test as well, but it costs more money. And then with the recent wildfires, a lot of people have been thinking about how that might affect COVID, but so far we haven't really had that uptick. The last thing is really to get your flu shot, and that's pretty much, actually I want to show one last thing, which is really fun tweets about perfect Zoom background meeting for meetings. This guy was one of the first people to actually take a picture of his workspace as a Zoom background. So then when he shows his Zoom face, everybody thinks he's at work, but actually he's at home. Not that we shouldn't celebrate working at home strategies, like I'm working at home today, but it's just kind of funny that he's using this. And this one, my boss turns itself into a potato in our Microsoft Teams meeting and can't figure out how to turn the setting off. So she was stuck like this the entire meeting. So his boss was a potato for the entire meeting. So I know somebody had asked about testing and the way in which we validate PCR tests. I would say that we actually do use real COVID for PCR testing. So maybe the original PCR test was developed on a strain of COVID-19 that wasn't a human specimen. I'm not really sure about the original PCR, but it's validated. Every PCR is validated. And when the CDC couldn't have enough testing kits available back in January, end of January, February, it was because their validation wasn't quite good. So they gave the validation to all these testing centers that we use. Their validation is actually using this PCR test against real COVID patient samples. And that actually is how they figured out that this PCR is right. So even though the PCR originally may have been developed without the actual specimen, it's validated to real COVID specimens, if that makes any sense. So it's above 99% sensitive and above 99% specific when they use this particular test against real patient samples, if that makes sense. So that's basically the answer to the question. Any thoughts, comments? and I unfortunately have to leave soon today, but I thought I just wanted to share a little bit of what's going on around the world. Of course, I didn't talk about Trump getting COVID, but that's like a whole, we could have like a fireside chat about that sometime.
Dr. Chen Hong, this is Kyle Kinsey, Vice President of Tissue. Just
Hi,
had a
Kyle.
quick question to you about some of the basics of keeping ourselves safe, keeping our office safe. You indicated that there's some, mistrust with the CDC and the political. Would you confirm that just basic hand washing and wearing masks and other office protections that we've taken place are the measures that are appropriate for keeping our offices and our workplace safe? Thank you.
Definitely. Thanks, Kyle. So that's a great question. So I would say it really boils down to the 3 W's again: wearing a mask, watching your distance, and washing your hands. I would add one other W for the office environment, which is wind or ventilation. So actually the 4 W's for office. And the offices that Donor Network West uses are generally amazing. Like they're not like my little hovel in San Francisco. The ventilation is excellent. So that combined with the 3 W's will get you very far in terms of protecting yourself. So
Peter,
the 4 W's.
it is Waldo.
Hey, Waldo.
Can you hear me, Peter? This one.
Yes.
Hi, I'm good to talk to you. Listen, one question. The first one is that what is the story, the newest on donors with having COVID positive? Is that something that we're going to learn about that?
Yeah.
And then the second one is that is immunity sticking out for long term?
Yeah, no, those are great questions, Waldo. So there are actually some reports. I don't think they've been published yet, unless everyone knows, but there have been some reports of mistakes being made from various centers with people who donors ended up being positive, but nothing happened to the recipients. So, just like we suspected, the bloodstream level of virus isn't very high with COVID, if at all there. So obviously now we're not accepting these organs, but I think in the future, just like with H1N1, there'll be some sweet spot where we realize maybe abdominal organs from people who had COVID may be okay if they didn't have these certain things. But right now, there are these isolated reports of people who did them by mistake and the recipients tended to be okay. Oh, and then the second question about how long immunity lasts. So natural immunity is going to be different from vaccine immunity. So there have been reinfections now. I didn't present that as a headline yet, but the first case in the US was this guy from Nevada. He was a guy in his 20s. He was an essential worker. He got it early on and then he got it later on. His second time he got it was worse, which is surprising. A lot of people think the second time you get it would be less symptoms or fewer symptoms. And then there was a case in the Netherlands in last week where the older woman got it and then she got it again and then she died, but she was immunocompromised. So natural immunity is probably not going to be as durable as vaccine immunity. So we think that natural immunity will probably last like 2 or 3 months, maybe. Convalescent plasma or antibody therapy, like the cocktail that President Trump got, can probably bring you on for 3 months, maybe. But again, that means that even if somebody had COVID, they can't just walk around like the rule of the universe. I think it's still going to be rare reinfection, we think so far, but you still have to be humble and protect yourself.
Hi, Peter. This is Chip from the Business Intelligence and Process Improvement team. I just wanted to offer a 5th W, working out.
All right. Yeah, I love that.
Yeah.
And for wellness.
Yeah.
Everything is a W in COVID. Yeah, working out for wellness is a great idea, Chip.
Hey, so Waldo is good then, huh?
Yeah, and Waldo too. Maybe Waldo could be another W. I'll come up with a new mnemonic. Oh, and Janice Whaley. So you see,
there you go.
Well,
I mean,
Peter,
I want to
thank.
Too bad we didn't have this on Wednesday because
I know, but I want to thank you for coming on. This is great. It was a great update, and I know you have some things scheduled back to back. So thank you for taking the time out for us, and we will be certain to engage you on a day where you have more time to spend with us.
Yeah,
We
definitely. And if
appreciate
people
it.
want to organize a specific update talk, you know,
Yeah.
in the future or anything, I'll be happy to do that as well for a group or anybody.
That would be
But
great.
thanks, guys.
We will arrange that. Thank you.
Bye.
Bye-bye.
Bye, Peter.
Okay, so we will return to the sharing the screen, Lauren, if you will, and we will continue. Waldo, thanks for joining us. And
Hey, my pleasure.
we're gonna continue with some more questions that were queued up. You're on mute, Rhonda.
So good morning, everyone, and thanks to whoever asked this question. The answer to the pay scales being posted is that we are not going to be posting online our pay scales when we post for positions. We just feel like that's not a best practice. And I think I mentioned this before in a previous town hall where when you put a whole range for a posting, it can sometimes have external candidates feel disappointed when they're not getting the higher end of the pay scale. And typically, if someone's coming into a position at more of an entry level layer, they'll come in at the lower end of the scale. So we find it as a best practice not to do a general posting. What we will do for our employees is we will share the pay scale with qualified candidates. So if you're applying to an internal position and you're one of the qualified candidates for the role, we will then share with you what the range is for that position. So feel free to call HR and we will share that information with you readily if you're one of our qualified candidates for a role. And I believe that's answering that question. We can go on to the next one.
Rhonda, if you don't mind reading the question because there's still some people on the phone.
Absolutely. So the next question is, how is the market increase determined when the job titles and descriptions have changed from what they were before, even though we haven't seen the updated titles or descriptions yet? And thank you for this question. It's a really good question because it's a very complex process. And because we've had so much change this year, it's been a very drawn out process. And so let me just go through it. I know I described this at our last town hall, but I think it's one of those things where not everyone is at each one. And so perhaps it needs another run through. When we did the market analysis, what happened was we went through the job descriptions and to the best of our ability at a time period when COVID was just getting impacted into our organization, we tried to update all of our job descriptions. At a certain point, we decided to collect all the ones that we had done and send them out for a market survey. That market survey was completed and it came back. Since that time, there have been some additional changes. And so when those changes had an impact to the duties that were dramatic and that would cause it to be something that would change in the market, we sent it back out to market and had it reassessed. So if in fact something has changed and it's a departure from the duties that were basically in the original job description, we would have it looked at again. And that would be the case moving forward as well. So let's say we do our market survey every 2 years. In between those 2 years, if something is to change about a job and we decide that we're going to change the roles and responsibilities within the organization, we change titles, we change what's happening, we would then again send it back out to market. And so because we changed a lot of the levels this time, we want to give an opportunity for the managers to meet with all of you and describe the new levels and have you understand them before we ask you to sign your job description. And that's out of respect for all of you to understand the changes and understand how it's impacting you individually. And so the process is in the place where we are now going through the final reviews with managers. And as they are accepting the job descriptions as being accurate and the way they are supposed to be moving forward, we are then having them sent out from HR to the employee to sign them digitally. So you're gonna see a DocuSign document come from HR to you so you can sign your job description. Before that time though, you should be having a one-on-one with your manager, at least a call where you talk about the position and where you are in the levels, if there's levels to your position, or if anything's changed about the job description, what's changed from your prior job description or title to where it is now. So you should be seeing those. I'm going to say in the month of November would be probably a safe bet that we'll be completing this entire process. What I can tell you is the next time we go through this process, I expect it to go much quicker because we probably won't have as many changes. The levels are a little bit of a differentiation from how we did things in the past, and they were really modified and improved for your benefit to help with career progression. And so because of that, there's been a lot more changes this year than I would anticipate moving forward. So I thank you all for your patience. I know it's been a lot longer process than it normally has. COVID's part of that. Part of it's the rewrites of the job descriptions that went a little bit slower than anticipated. But I think we're in a much better place and it'll be ready for us moving forward. So thank you again for the question. And next question. So our next question is, what is the status of the 80 hours of COVID leave? Is it being extended, or if not, when does it expire? That's a really good question, because I know since COVID hit, there's been a lot of questions of the laws and what's available and what's not available and how long will it last. And the status for the 80 hours of COVID leave is that currently it was put in place in April of this year. And it was put in place to help employees have additional leave so that they wouldn't be out on COVID leave and not have some sort of support. The government put in a deadline for it to expire as of December 31st of this year. What I can tell you is that is the current information that we have. Being the fact that we know COVID is going to be with us beyond December 31st, or at least we envision that it will be with us beyond December 31st. I would anticipate that might be reviewed, but as of right now, that is the deadline that we have. So anticipate that if you're to go out on COVID right now, if you have not currently used your 80 hours of COVID leave, it would still be available to you up until a diagnosis of December 31st. So you would still have that available to you. Anything after that point, at this point, the government's not allowing it, but I will keep you updated if that changes. I have a strong suspicion it might, just because they want to have equity and still support, employees through this time period. So I'll keep you posted if that changes. And next question. Okay, this question, is it equitable that some staff have the privilege to breathe freely in private office while others do not? Can Donor Network West management consider accommodations to allow more healthy breathing without staff having to reveal medical conditions to them? Again, a really important COVID question. And I'm glad you asked it, because I think it's important for you to understand how we're making these decisions, so you can understand what goes behind the reasoning behind the decisions that we've made. So obviously the space that we have in the building is finite. We don't have endless office space. The office space that's currently occupied by people more often than not is because of the role they have and their need for having private meetings on a regular basis. And that's how the accommodations were originally decided for who would be in what offices. For the spaces that are not currently occupied, some of them have been used for people with specialty situations where they may have a medical condition that requires them to have more separate accommodations. What I can tell you is that because we have a finite amount of space, it is important for you to communicate with HR if you have a situation that we need to be aware of, and then we will talk with you. We'll do the very best we can to accommodate people's needs. I can tell you that even for HR, we don't ask you to reveal your medical condition. What we ask for is a medical certification. And so that's a process that we go through. And then there's a process of an interactive conversation, and then an accommodation conversation where we decide whether or not we can accommodate someone's request. And each situation is very unique. And so we can't have hard and fast rules on how this gets done. We really have to do it on a case-by-case basis, so we can provide the best, answers for people given the circumstances that we have. In other words, if we have no more room available, obviously an accommodation for a separate space is not something that we could do. And so we do the very best we can given the circumstances and the opportunities that we have within the organization. But we also, as a consideration of trying to be safe, as we have our protocols that we keep to right now, so that at least you are safe in the spaces wherever you are within the organization. But thank you again for asking. And if you do have questions and it's pertaining to your own situation, I recommend you come see myself or Rosemarie. We will talk it through with you and we'll work out a solution with you for your situation. So thanks again for that question.
Hi, everybody. I was Luis Mayen and myself were elected, if you will, to answer some of these questions about COVID and working from home and so forth. So I'll just read through the first question here real quick. The COVID situation remains concerning. There has been a large amount of financial and human resources dedicated to ensure a safe environment, causing a negative impact on the work environment and job satisfaction. If the office staff who can work at home were able to, then those who are required to come in could be provided with more private and safer spaces. There's been no explanation from upper leadership for the continued force of people coming in when most companies continue to allow remote work as an effort to support their workers in the community during these times. Why does leadership continue to impose restrictions that are uncomfortable and impossible to 100% maintain instead of being flexible with remote work? Luis and I have met a couple times over the last couple days, as well as the rest of the executive leadership to discuss these and many other questions related to COVID and the workplace. So I want to just kind of reveal to you some of the answers in regards to that. So first of all, I just want to address other workplaces. And of course, thank you for this compelling question. We've certainly heard this throughout the office multiple times, and so I know there are many that have this question on the mind. While many companies in the Bay Area and around the globe, obviously, have had the opportunity to allow employees to work remotely. Many companies just right here in the Bay Area. But we're not one of those companies. We're a very unique company in that we require many within our workforce to be in the building just based on the job they do, because they can't do it from home. So much like a hospital, a surgery center, or a doctor's office, which have all remained in office, we are working directly with patients and handling very highly sensitive information that's protected under federal law. And it is imperative to this organization, to our hospitals, and most importantly to our donors and their families, that this information stay secure. Now, while some employees may have necessary internet bandwidth to transmit large files securely from their home, others do not. And we would need to assure that each employee who works remotely would have a secure location within their dwelling, free of noise and distractions for their entire shift. Many do not have the ability within their dwelling to provide this assurance. And this assurance and being able to provide those two things is imperative for being able to work remotely. So in an effort to remain equitable, a decision was made to bring all employees back into the office with all the CDC COVID-19 workplace guidelines, or as Dr. Chen Hong and others said, all the W's. And all the things we do is wearing a mask and washing our hands. And as long as those are in place and in force. And while our comfort may be challenged by wearing a mask for your entire shift, following this and all the other social guideline distances significantly reduces and decreases the risk of a workplace exposure, which we have been free of to date. The path that D&W chose in bringing our teams back to work is not unusual in the OPO sector, and many OPOs have already fully implemented same schedules as we have in bringing all their staff back to work for these exact same reasons. Our top priority at Donor Network West is to assure that our staff is safe and that we are able to, without delay, fulfill the wishes of the donor and the donor family and provide stellar services and secure services to our hospitals. So these are the explanations about why we continue to come into the office and not working remotely. Next question. We don't feel heard or validated about our desire and ability to work from home. To me, it seems safety bias clouds our decisions. I'm just afraid of this disease. Can you help me feel heard? We hear you. Believe me. This discussion of COVID and COVID safety and handling this as a workplace has dominated discussions among the leadership team since early February. We hear you. We greatly respect COVID, but let's be transparent. We don't like it either. And like you, especially me, speaking for myself, I'm scared too. I don't think there's anybody that's on this call right now that wants to test positive for COVID, that wants to get COVID, because while some people may be just fine, others not so much. Which is why we continually enforce all the W's, the CDC guidelines, to make sure that we're keeping you safe, keeping ourselves safe, because like you, we don't want to catch it either. So, you know, masks are hard. They're hot, they're stuffy. You know, I've been in a position most of my career where I've had to wear one, whether it's recovering donors or being in that environment. So like many others, I'm used to them. Like some others, I'm not. They're hot, they're stuffy. You can't communicate with other people. We don't get to have our big meetings. Look, it's a pain for everybody, and everybody is challenged right now, but it won't last forever. And we feel confident as a leadership team, and we want you to feel confident that the workplace guidelines set forth by different regulating bodies and within DNW are here to keep you and all of our staff safe.
I can take this one. So the question was, can you provide an update, or can you provide a status update on our diversity goal? Has there been a mention of an equity work group in the past? There has been a mention of an equity work group in the past, and has this been formed? And so I'm happy to report that, yeah, the initial members of the work group have met. We've had one meeting so far. We're just starting our journey here. So we've been able to review some of our desires and outcomes for outcomes, accountability, measures, metrics that we'll be able to report through the organization. There's going to be a lot of visibility on this. It's definitely not something that's just going to happen behind closed doors. We're hoping to be able to see measurable change and provide that transparently throughout the organization. We're also going to have an opportunity for different staff to participate. We'll be having an application process, which we'll be communicating with you guys all shortly. So I guess the update is just that we're pretty early on. We're still looking to identify the appropriate leader for the team. I'm really honored to be the executive sponsor, so I'll be making sure that the executive team is aware and able to keep the work group accountable, hold us accountable to actually producing measurable change. That's it for my updates. Pretty early on. Thanks.
And this one is mine. The question is, why doesn't Donor Network West give any financial compensation for precepting? And I think that's a great question. First of all, I think we all should thank those who work every day and night to make sure that our staff are receiving the best possible experiences and that they're successful to excel at Donor Network West. I recognize, and I think the entire leadership team recognizes, that it's added responsibility, but from my own personal experience, it's so rewarding when you see a trainee come off orientation and then they go off and they do really well. So with the new job descriptions that Rhonda talked about, you're going to be reviewing with your manager, training and precepting are part of that ladder to advancement. So I will say, with that said, we have been discussing a preceptor differential for staff assigned to trainee. And again, because we recognize that it's additional time and work. So we also need to ensure that there's equity across all the many job functions, and not just for organ operations, those jobs that require preceptors. So we're looking at the overall financial impact and how best to roll out a fair and equitable system. And as we discuss this as a leadership team, we're dedicated to having an answer to this compensation for precepting question by our staff meeting, which is scheduled in December. So hopefully we can have something in place, and we'll have more information for you in December.
Okay, we're going to segue into a fun segment about acknowledging new team members and promotions. But before we do that, I just want to make sure you all know that there's going to be an open QA at the end of this where you're free to ask questions. For those of you who may be shy, you can use the chat box to pose your questions, and I would ask one of our leaders to be paying attention to that. But we will go into an open mic session where you can give comments or ask more questions. If you feel like any of the questions that were answered need further discussion, we can do that too. So at this time, we will move into this segment. Stick behind Rhonda?
I'm what?
Are you going to go ahead, Rhonda?
I think we're just showing the moves within
Okay.
DN West. So
Okay.
Lauren's doing a presentation of the pictures of the new people. So you'll see it as it comes up. I guess. for
So
the
it's a
people on the
silent
phone-
video.
Yeah, for the people on the phone, I can read Dana. I'm just going to read first names because I don't want to botch everyone's last names. Dana is a donor record coordinator who joined us, moved within DNS. So these are Q3 moves. And then we have Zarina as a clinical procurement coordinator and Crystal as an organ preservation coordinator.
Very nice. Welcome.
We also have Brittany as a family resource coordinator. And I hope I'm saying this right, Pakatana as a clinical procurement coordinator and Laura as a tissue recovery coordinator.
Welcome, lady.
And then Q3 promotion, we have Nicole as a regional director of Nevada, Danielle as regional director for East and West Bay, and Jocelyn as a director of preservation and surgical services.
Congratulations, ladies.
Additional promotion, we have Luis as vice president of strategic partnerships and business development, Chanel as manager of recovery services, and Jacob as manager of recovery services.
Congratulations, lady and gentlemen.
And our Q3 new hires, we have as a new PC, Catherine as a donation coordinator, Jawan as a tissue recovery coordinator, Lauren as the VP of marketing and communications, and Margaret as a tissue recovery coordinator.
Welcome to all of you.
Additional hires are Kurt, tissue recovery coordinator, Rebecca, tissue recovery coordinator, Nicole, tissue recovery coordinator, Brian, donation program consultant, and David, clinical procurement coordinator.
Congratulations. Welcome.
Lots of new people. We have Jennifer as a donor record coordinator, Abulaziz as a donation program consultant, Haley as a clinical procurement coordinator, William as a donation coordinator, and Emily as an HR analyst.
Welcome. Welcome to the team.
Melissa joined us as a CC, Brittany as a FRC, Candace as a tissue recovery coordinator, Robert as a clinical operations manager, and Rebecca as a clinical procurement coordinator.
Welcome to the team.
And our last two, Anju as a OR circulator and Corey as an OR circulator. Welcome, everyone.
Yeah, welcome. All right, congratulations to those who are new joining our team, and then to those who've really been promoted. I am really pleased to see that we have people within our team moving into new roles and also being promoted. It's something that I think we will continue to do. And I'm excited that we are making a lot of changes in that area. So thank you all for being with us during that session. And now we will open the floor for questions. If any of you have any more questions or comments.
Hi, everyone. This is Tiffany. I'm the supervisor of Oregon operations. I had a follow-up question to the leadership team in regards to allowing people to work from home. What I heard from Kyle was that, shortened was that everyone cannot work from home because you cannot ensure that we have the correct bandwidth and a quiet place to work. However, pre-COVID, there were people who were working from home and some people who worked in the office. It wasn't equitable. Some people worked from home, some people worked in the office. So can you guys explain why we as supervisors and managers, if we can prove that our people have the correct bandwidth and can work from a quiet place from home and still be productive, why can't we work from home?
Tiffany, this is Janice. Thank you for your question. I think there are a number of reasons why, as an organization, we cannot pivot everyone to working from home. I also think that we as a leadership team have owned the fact that we really have not clearly defined who works from home and who does not. So you'll be hearing from us within the next couple of weeks of roles that can work from home and roles that will remain within the office. And our apologies for that clarity not being provided. But there are certain roles that are very valuable to the organization. And, we're mission focused. Anytime we miss a call is dropped. That's a life that may not be saved. And so there are varying roles that it is important that your focus for your entire time at work is making sure that you're responding to the call or you're handling different issues. And so we will discuss that further. We will put out what roles will work from home, and we're going to be consistent moving forward. So I can't speak to what we did prior to COVID. And I'll be honest with you, as a new CEO, there were certain areas of our organization that I had not looked at and reviewed. And so we're going to be very clear and transparent with you all moving forward as to what roles we think can continue to work from home. We have certain roles where you're not necessarily coming in the office, but most of your work is in the hospitals. So, and in essence, those roles typically work from home and their workplace is the hospital. So we need to be clear and define that, and you'll be hearing from us in the next couple of weeks, a more defined and the reason why as we move forward. And thank you so much for your question.
Thank you, Janice.
Okay. All right. Any more questions?
Hi, this is Ravi from research.
Ravi.
Hi. So my question is about getting vaccines, and I heard from my friends that their company is contacting, manufacturers of vaccine and putting an order in advance so that they get the vaccine first. So I wonder whether any such effort that we had taken, or what is our current plan?
That's a great question that I never thought of it that way. I'm sure the company that you're talking about is probably a large company that has a lot more resources than we do, but it's something that perhaps can be discussed with the OPO community to see whether or not we need to find a way to be as a priority. And I think what I've heard just on the news was that they're going to prioritize based on risk first and then move down as we go along. So I really have not put a lot of thought into that. I'm happy to research that and see that was a great question for Peter, because he probably could share a little bit more. I think we would need to connect ourselves to a larger organization, preferably maybe a hospital that could help sponsor us in a situation like that, but these are just all thoughts of mine with regards to that. And I'll be happy to follow up with you on more details as I know more. So thank you for bringing that up.
Thank you.
Janice, there's a question in chat and I can read it. It says, question for the ELT team in regards to wearing N95 and KN95 masks when in the office, not in a private office. Can you explain the guidelines? Is this a requirement for the regional offices as well as, or just Bishop Branch and Norris Canyon?
Thank you for that question. And I think we had an incident. It was not an exposure within the office, but some of our staff were exposed to someone, and I sent out an email about that. And for the time, not knowing how many people were involved, I did ask for us to be supplied with N95 mask. I also shut down all of our big conference rooms until we could determine what was going on. And I did the same thing when in February, when we first realized that we had the pandemic situation. And so we've since ramped up our disinfectant cleaning that is done several times a day now by a group here in this office. And I don't know if Marilyn can speak to what's going on in the other offices, but we certainly are finding ways to make sure high touch spaces are disinfected. And with regards to masks, I think that we are at a place now where we can wear our other masks, but I would admonish you that if you are gonna be in a situation where you're gonna be around multiple people at one time, I just wanna make sure that you have the N95s available to you to use. And so I want people to feel safe. I want people to know that those are available to them if they feel more comfortable. I know for me, when I know I'm going to be in an environment where I'm not sure what's going on, I put on my N95s. And we're fortunate because we have the ability to supply those to the team. But as long as you have a mask that securely covers your face, and there's several out there, you don't have to necessarily wear an N95. It was put in place for that period of time where our HR department and several people were making sure that we identified those who may have been in contact with one of our team members. That has since cleared up. As far as I know, everybody is fine, so we can go back to what we did. The conference rooms will not be opened until November 1st. That is intentional. It's just something that I think we needed to do to take a step back. As you heard, there are areas where people have relaxed and they're now seeing surges. So I wanted to take every precaution to make sure that we did not have a spread. Our work is so critical. And so exposure to something like this would be devastating, not just to us and our families, but also to the recipients and the community that we serve. And so it's very important to me that we take a step back, we put things in place, and as we identify what's going on, then we can go back to another setting. So if you feel comfortable wearing your mask that is not an N95, you can do so moving forward. But just know that the N95s are available. And I would caution you that if you're going to be in group settings, even if you're distance, it might be best to wear your N95. As you can tell, there's a lot of stuff and propaganda going on about what is going to protect you and what's not, but something that has been consistent and most of us can testify to, if you wear your mask and you do all the other W's, you're going to be fine. So thank you for that that question. I hope I answered it. Are there any other comments or questions?
This is Jocelyn. I don't have a question, but I do have a comment. We recently attended the Leadership Summit, and I am very excited about a multitude of things from that summit. But one of the things that I am most excited about is your charge as CEO to all of the organization's leaders and the organization in general to include the people who are doing the work in making our decisions. I think that is very important. I think it's something that we talk a lot about, and I'm really looking forward to it. I think that coming from you to all of the leaders, it makes a difference. You know, we talk a lot about it, but I don't think we do a lot of follow through with it. And even before, you know, you gave the charge, just the collaboration that I have seen lately with, you know, a multitude of people, Nicole, Valerie, Tiffany, both Amy and CG in the education department, among others, just a few named. We have really talked about, you know, including the roles who are doing this work before we start to make decisions and creating these work groups. So I'm really excited about that.
Well, thank you, Jocelyn. And I'm committed to that. I think that when your workforce is a part of the changes that take place, they're more engaged. And I hope that you see that. If you're not seeing that from your leaders, call them out. We are not necessarily going to agree with everything. And I think first and foremost, I've asked my leaders to make sure that whatever changes we're making, that if you bring up an idea, as long as it is not going to violate a policy, a procedure, a reg, we need to try it. And some things we're going to try as we move forward with our lean transformation that may not work, and we can just pivot to doing something else. And that's why what I like about lean transformation, you're able to bring up an idea, you're able to set a procedure behind it. And if it doesn't work, you can drop it or you can make the changes that are necessary so that it can work. And so as we move forward to transform our organization into a lean organization, the biggest component of that is team engagement. So I hope that you guys will be vocal, you'll be engaged, and you are the ones. I'm in this office behind a desk. Those people that are out in the field or any part of the organization where they work, I can't speak to it as well as you can. And so I hope that you will continue to be engaged and share those things with us. And thank you so much for your comment, Jocelyn. Any more comments?
We have a question in the chat box that's asking, it's from Nakia asking, in regards to the 80 hours offered for COVID related time off, are there any other options for individuals who've already utilized that if needed? It's her understanding that the ESL may not be utilized now. And you are correct, Nakia. We had decided for a short period of time to allow ESL to be what was added to the COVID situation for people. But for the 80 hours, if you've already utilized it, you can obviously use your PTO, which is utilized for any sick time. So that is what you would go to next. So if you've already used the COVID 80 hours for COVID related incident and you have another COVID related incident, you would then go to your PTO.
Okay. Any other questions or comments?
Thanks, Nakia.
No questions or comments? Okay, does everybody want to buy some time back to your day?
I'd like to say that, first of all, thank you all for your very candid questions, and that if something wasn't answered because it's something private that you'd really like to have someone answer for you from the HR department, feel free to reach out to us. We're here as a resource to you, and we understand that some things aren't meant for a broader group, so feel free to contact us. Okay.
Was there something else in the chat that we missed, Lauren, or are we good?
No, we've covered all the questions as of right now.
All right. Well,
Janice?
Yes.
Hi there. This is Gwen. I'm
Gwen.
stepping in at the last minute. Sorry, I couldn't unmute myself. I just want to do a circle round if I could, because Aftercare's been working on the Facebook page. Kudos to Megan Bondi. We have a private Facebook page for our donor families, and she's been looking at the data recently. We have 100 families who are participating, with 14 families who have more than one person and 90 families who are asking to get in. So I wanted to just bring that back to the whole team, because the way that families are treated by our teams when they're in the hospitals and dealing with the death of their loved one has a lot to do with them being able to say, yes, we want to be involved in another way. So we have donor families being served by the Facebook page because of all the work that's being done. And I just wanted to throw out a huge thank you to everybody who cares for those amazing families. Thanks.
Thank you so much, Gwen. Appreciate that.
We did have another question that asked, will we receive information or outcome from the state interviews? Yes, you will receive outcomes. I anticipate at the next meeting in December, we'll share that with everyone. We'll probably have some themes by then, and that'll allow us an opportunity to take all the information and compile it and put it into a logical format that can kind of find some themes that we'll be working on as an organization. And hopefully by then, the leadership team will have an opportunity to also think about what those themes are and maybe some things that we'd like to work on as an organization. And a lot of them, because the state interviews are particular to your own development or situations in your own situation, there'll be individual plans that are created for each of you with your leader, and that's something you need to collaborate on with them. And if you need additional assistance from HR for some of those plans and creating some solutions, I'm here for that as well. So we're going to be looking at kind of a multi-layer approach to this. We'll be looking at individual needs as well as group themes, and the group themes will share as a group with some logical outcomes that we can see as some solutions for those. And we have Ayana's asking a question. Is there any interest in launching 360-degree reviews so that the managers get timely and relevant feedback? Yes. I don't know if 360s are actually timely because they're usually done on an annual basis. So I won't necessarily say that's timely, but I would still think it's relevant feedback. And that's another reason for the stay interview is so managers do get feedback. I also encourage all of you at your quarterly meetings or at your one-on-ones, if you want to give your manager feedback, that is the time to do it. That's what it's for. It's a two-way conversation. It's why we added the quarterly reviews. So there's an opportunity for feedback between the manager and the employee on a more frequent basis, where the conversation about development and about how we can help you and be better leaders for you, it's an opportunity to have those conversations. And we want that candid information. And so I encourage you to be candid. If you're having challenges with sharing your information and you want another resource for it, let me know. I'm here for you as an outlet as well. So I want you to know that if we get a software, we're looking at different human resource information systems. And if we transfer to a new one of the criteria I'm looking for is hopefully one that has the ability to do a 360-degree review, because it's good to get feedback from employees and from peers when we're doing the reviews on an annual basis, because that gives a more holistic view of who we are as an individual within the organization and our contributions. So Ayana, thank you for the question. It's a great question. I'm hoping to be able to do that. If not, we may do a manual process in the future. We'll look into it, but we wanted to wait for the RFP process with the HRS system. I shouldn't say HRS system, but the Human Resource Information System, so that we can look at whether or not that's going to be included in the package that we're hoping to find.
Yeah. So and I'll just tag on to that, Ayana. We are looking at a way to allow for feedback outside of the stay interviews for our leadership team. I hope that we can get to a place where we can be very honest during the stay interviews on how we're feeling and what's happening. But I also know that there are some good, not necessarily 360s, but type of reviews that, Ron and I are going to look into, and so that we can actually give our leadership team more feedback on areas in which they can help to further in their role as a leader. So thank you for that question. Robbie had a question ahead of that, asking if we were going to do pool testing, like random COVID testing within our office. We have discussed it. And we're considering that as an option. I'm not so sure it's going to be something that is mandatory, but we would like to have that, because I think the more you know about COVID, the better. And so Obviously, we need to get some things in place, but we're working on a system where we can do that. And Lacey has a great question. Are we having a holiday gathering? So, you know, I think this year is, you know, it speaks for itself. There's not a lot of places that are gonna be open for us to have it, nor do I feel like we're in a place where it's safe enough for us to do that. And so we are going to have a virtual holiday party. We're going to have a virtual all staff meeting, and then we're considering ideas, and I would like input from the team on how we can get short video clips of how you are celebrating. It's got to be kosher, but we think that we want to see people celebrating for about an hour after our staff meeting in some form or fashion. So we've not worked through all the ideas. Alan looks like he knows exactly what he wants to do, but we want to be creative and, you know, be able to get a small insight of how you're celebrating the holidays. So we're going to work on something, would appreciate any ideas. It's so frustrating to have to go virtual, but we know it's the best thing right now, instead of having a gathering. So we're going to do some of the same things, but it will be over virtually. So it won't be the big party that we had last year. Hopefully sometime next year, we'll be able to redo a celebration just to celebrate the fact that we're now in a better place. And I think everyone on this call is hopeful for that. So stay tuned, share some ideas. I've seen some unique things from other organizations. Just be mindful that everybody that's in your video, whatever you create, is appropriate so that there are no bloopers, you know. So anyway, other than that, I think we're ready to end. I don't see any other questions.
This is June Wallace. Right. I would like to give a shout out to someone. I'd like to give a shout out to Kathy Clark. Kathy Clark has been working with the CDLs because we're always looking for volunteers. And some of the donor families that they're working with, they've been able to share those families that are interested. And we've received a few volunteers from the Family Services Department. So a big shout out to Kathy Clark for that.
That's great. And Kathy Clark is celebrating her birthday, her liver transplant anniversary. So good to hear more great things. Thank you for sharing, June. Any other shout outs?
Janice?
Yes.
I just wanted to tag on to what you were talking about the holidays. So just to mention, everybody should have received an invitation for a virtual Halloween costume contest that we're having. So that's coming up. And if you didn't receive it, I think Jacqueline's ready. You know, ping me and I can send you the invite. And then you'll be receiving information soon this week about our Thanksgiving celebration. So we have some celebrations. They're all virtual, and well, not all virtual, but for the most part, more virtual than in person. But we are continuing, as Janice said, the traditions that Donor Network West has done over the past few years. And so you'll be receiving communications soon about all of those activities.
All right, there's a new message.
Will food be provided again this year for staff working on Thanksgiving and Christmas? Yes.
Yes, we will make that happen. Obviously, we kind of have pivoted away from potlucks per se, and so it will all be catered so that we, you know, don't have any issues. It's really difficult right now to be safe in that area. I did propose that maybe baked goods. There are some awesome bakers in our team, and so we may do something along those lines, but your meal in its entirety will be provided from a cater type service. All right. Anything else? Gosh, you guys are a quiet group. Well, thank you for all your comments. Thank you for allowing us to answer some questions. And I think we may want to leave open a venue for questions to be turned in any time of the year and not just, during a town hall. So if you ever have any questions, there are different ways that you can get that to us. And, you can email me directly. You can follow, I think Lauren has a way for you to send in questions to as well, and she can provide that to us as we move forward. Suggest we use some good news as a model for a holiday party. Okay, what do you mean by good news?
Have you ever seen John Krasinski's, or is it Krasinski's Good News, Some Good News video, YouTube?
Probably not.
Oh, you've got to see it. It's really good. So he has some good ideas for how to party virtually.
Okay. All right. Well, let's look it up, team, and we'll make it as exciting as we can. Thank you for that, Sharon. All right. Thanks, everybody. Have a wonderful day. And I think it looks like we're giving you about 45 minutes back. Appreciate you joining us. Take care.